Article 517 of the International Building Code, or IC, regulates the design and construction of patient care areas within healthcare facilities. These regulations encompass several key aspects. Firstly, fire resistance ratings are mandated for walls, doors, and ceilings to contain and slow the spread of fire. Secondly, room finishes and equipment are chosen to minimize the potential for fire spread, using materials with low flammability and flame spread ratings. Thirdly, electrical and mechanical systems are designed to ensure continuous operation, particularly during emergencies. This includes backup power systems and essential equipment that must remain functional. Patient care areas are specifically defined as spaces where patients receive direct medical care. These areas include examination rooms, operating rooms, recovery rooms, and intensive care units, among others. The application of Article 517 to chiropractic offices and, more specifically, chiropractic exam rooms hinges on the nature of the services provided. If the chiropractic services involve invasive procedures such as injections, surgery, or manipulation under anesthesia, then the exam rooms are likely to be considered patient care areas. Consequently, these rooms would be subject to the requirements outlined in Article 517. Conversely, if the chiropractic services primarily involve non-invasive procedures such as spinal adjustments, massage therapy, or rehabilitation exercises, the exam rooms might not be classified as patient care areas. In such cases, the full scope of Article 517 requirements may not apply. The final determination of whether Article 517 applies rests with the local building authority or fire department. They possess the authority to interpret and enforce building codes within their jurisdiction. When evaluating a chiropractic office, these authorities may consider several factors. One factor is the types of services provided, differentiating between invasive and non-invasive treatments. Another consideration is the frequency and duration of treatments, assessing the potential risks associated with prolonged patient exposure. The presence of flammable or hazardous materials within the office is also a key factor. This includes materials used in treatments or for general office operations. Emergency response protocols are reviewed to ensure the office is prepared to handle potential medical emergencies. To ensure compliance with all relevant regulations, chiropractors should take a proactive approach. Firstly, consult with the local building authority to determine if Article 517 requirements apply to the specific exam rooms. This consultation provides clarity and avoids potential misunderstandings. Secondly, comply with all applicable building code requirements, even if not explicitly mandated by the building authority. This demonstrates a commitment to patient safety and regulatory adherence. Thirdly, maintain a clean and safe environment for both patients and staff. This includes regular cleaning, proper equipment maintenance, and adherence to safety protocols. Article 517 focuses on several key aspects of healthcare facility design and construction. Fire resistance is paramount, requiring specific ratings for walls, doors, and ceilings to contain fires. Material selection is critical, mandating room finishes and equipment that minimize fire spread. Redundancy is required, mandating that electrical and mechanical systems must be designed for continuous operation during emergencies. Examination rooms are where patients receive direct medical care. Operating rooms are where surgical procedures are performed. Recovery rooms are for post-operative patient monitoring. Intensive care units provide critical care for seriously ill patients. If chiropractic services involve invasive procedures like injections, surgery, or manipulation under anesthesia, Article 517 may apply. If chiropractic services involve non-invasive procedures like spinal adjustments, massage therapy, or rehabilitation, Article 517 may not apply. Local building authorities or fire departments determine Article 517 applicability. Building authorities may consider types of services provided and frequency and duration of treatments. Building authorities may also consider the presence of flammable or hazardous materials and emergency response protocols. Chiropractors should consult local building authorities to determine Article 517 applicability. Chiropractors should comply with all applicable building code requirements. Chiropractors should maintain a clean and safe environment. Article 517 outlines requirements to minimize fire hazards and ensure operational continuity in healthcare facilities. Walls, doors, and ceilings need adequate fire resistance ratings to contain a fire. Low flammability and flame spread ratings are required for room finishes and equipment. Backup power systems and essential equipment ensure continuous operation. Examination rooms and operating rooms provide direct medical services. Recovery rooms and intensive care units are also types of patient care areas. Article 517 may apply to chiropractic offices that offer services involving injections, surgery, or anesthesia. Spinal adjustments, massage therapy, and rehabilitation services may not be subject to Article 517 requirements. Local authorities determine whether Article 517 applies by considering treatment types, frequency, and risk factors. Consulting with local authorities ensures compliance with Article 517. Adhering to all building code requirements promotes safety in healthcare settings. Maintaining a clean environment reduces risk for patients and staff. Article 517 prioritizes fire safety, material selection, and operational continuity. Fire resistance ratings on walls, doors, and ceilings help contain fires. Low flammability materials reduce fire hazards from room finishes and equipment. Emergency power systems ensure continuous operation during facility outages. Patient care areas include examination rooms, operating rooms, recovery rooms, and ICU. Injections, surgery, and anesthesia in chiropractic services may trigger Article 517 requirements. Article 517 may not apply for chiropractic services that involve spinal adjustments, massage, or rehabilitation. Local building or fire authorities determine Article 517 applicability. Local authorities consider service types, treatment frequency, material risks, and emergency protocols. Consult local authorities about Article 517 requirements in chiropractic offices. Comply with all building code requirements to promote a safe environment. Maintain a clean environment for patients and staff to minimize potential risks. Article 517's requirements enhance fire safety and continuous operation in healthcare. Fire resistance ratings are required for walls, doors, and ceilings. Room finishes and equipment must have low flammability. Continuous operation requires emergency power and well-designed systems. Patient care areas include examination rooms, operating rooms, recovery rooms, and intensive care units. Invasive chiropractic procedures could make exam rooms subject to Article 517. Article 517 may not apply to non-invasive chiropractic services like spinal adjustments. Local authorities determine if Article 517 applies to a specific chiropractic office. Building authorities consider service types, treatment frequency, and material hazards. Contact your local building authority to determine if Article 517 applies. Compliance with building codes promotes a safe healthcare environment. Maintaining a clean and safe environment protects patients and staff. Article 517 minimizes fire hazards and ensures operational stability. Fire-resistant walls, doors, and ceilings are key for fire containment. Low flammability materials for finishes and equipment prevent fire spread. Emergency power systems and robust designs guarantee continuous operation. Examination rooms, operating rooms, recovery rooms, and ICU are considered patient care areas. Chiropractic services that involve injections, surgery, or anesthesia may fall under Article 517. Article 517 may not apply if the chiropractic office focuses on spinal adjustments, massage, or rehab. Local authorities decide if Article 517 applies, considering factors such as service types. Consult with local authorities to see if Article 517 applies to your chiropractic office. Compliance with all relevant building codes is essential for safety. Consistent cleaning and adherence to safety protocols create a secure environment.